Welcome to Healthy Care, where your health is our priority. Picture this: your body is a masterpiece, a finely tuned system working tirelessly to keep you alive and thriving. But what if, deep within, a silent storm is brewing? What if your body is whispering warnings, subtle yet crucial, begging you to notice before it's too late? Cancer is a master of disguise, often hiding in plain sight until it reaches an advanced stage. That's why early detection is not just important, it's a game changer. Today, we're unveiling 12 critical warning signs of cancer that many ignore. These aren't just fleeting discomforts, they are urgent messages from your body, telling you something isn't right. Ignoring them could be a mistake, but recognizing them early could save your life. Stay with us, because the knowledge you gain today might be the key to protecting yourself and your loved ones. Let's get started. 1. Changes in appetite. Changes in appetite can serve as a significant indicator of potential health issues, especially regarding cancer. If you experience a sudden and unexplained loss of appetite, it could point to cancers affecting the digestive system, such as stomach or pancreatic cancer. As these tumors grow, they can disrupt normal digestive processes, making it increasingly difficult to eat or find joy in food like you once did. So why does this change happen? When cancer develops, it often produces certain chemicals and hormones that interfere with the body's natural hunger signals. This phenomenon, known as cancer-related anorexia, leads to a genuine reduction in the desire to eat. Cancer cells can release inflammatory cytokines, which are signaling molecules that can alter metabolism and appetite regulation. These cytokines can affect brain regions responsible for hunger, such as the hypothalamus, making you feel less inclined to eat. Additionally, as tumors grow, they can physically obstruct or compress parts of the digestive tract. This can lead to symptoms such as discomfort, nausea, or pain while eating, which naturally discourages a person from wanting to eat. The combination of altered chemical signals and physical blockages can create a vicious cycle. Not eating leads to weight loss and nutritional deficiencies, further exacerbating health issues. 2. Unexplained fevers or night sweats. While we usually think of fevers as a sign that our body is fighting off an infection, persistent or unexplained fevers can indicate something more serious, like leukemia or lymphoma. These types of cancers specifically target the immune system, which can lead to frequent or prolonged fevers that seem to come out of nowhere. So how does this happen? When cancer cells invade the body, they can trigger an inflammatory response. This response causes the immune system to react as if it's fighting an infection, resulting in a rise in body temperature. With leukemia and lymphoma, the body's immune cells become dysfunctional, and this irregular activity can lead to fevers that just won't go away. Now, let's talk about night sweats. These can be especially concerning and are often associated with lymphoma. If you're waking up in the middle of the night drenched in sweat, even when the room isn't hot, that's a sign to pay attention to. The same inflammatory response that causes fevers can lead to fluctuations in body temperature, resulting in those uncomfortable night sweats. 3. Skin changes. Skin changes are another symptom that can often be easy to dismiss, especially since we're conditioned to view skin conditions primarily as cosmetic issues. However, changes in the appearance of moles, the emergence of new growths, or sores that refuse to heal could be early signs of skin cancer, particularly melanoma. Skin cancer occurs when damage to the DNA in skin cells leads to mutations, resulting in rapid and uncontrolled growth of those cells. When it comes to melanoma, it often presents as an irregularly shaped mole or a spot that changes color or size over time. This type of cancer is particularly dangerous because it can spread quickly to other parts of the body if not detected early. According to the American Cancer Society, early detection of melanoma dramatically increases survival rates, making it essential to keep an eye on your skin and any changes that occur. So how can you differentiate between benign skin changes and those that might be more concerning? A good rule of thumb is to remember the ABCDE rule for moles: asymmetry, border, color, diameter, and evolving. If a mole is asymmetrical, has irregular borders, is varied in color, is larger than a pencil eraser, or changes in size or shape, it's time to see a dermatologist. Regular skin checks can help you catch these changes early, so be proactive about your skin health. 4. Persistent coughing or hoarseness. While it's pretty normal for us to experience a cough now and then, especially during cold and allergy seasons, if you have a cough that lingers for weeks or seems to get worse, it could be a warning sign of lung cancer or cancers affecting the throat. When tumors develop in the lungs or in nearby areas, they can irritate the airways, leading to chronic coughing. Additionally, if cancer affects the vocal cords, it can result in hoarseness, making your voice sound raspy or strained. So what's actually happening in the body? As a tumor grows, it can press against the airways or even invade surrounding tissues. This irritation triggers a reflex to cough as the body attempts to clear the obstruction. When the vocal cords are involved, they can become swollen or damaged, affecting your ability to speak clearly. Now, how can you differentiate a persistent cough from a regular one? If your cough is accompanied by other concerning symptoms such as blood in your sputum, unexplained weight loss, or persistent fatigue, it's especially important to consult a healthcare professional. Also, pay attention to the nature of the cough. If it's dry, harsh, and doesn't improve, that's a sign to take seriously. A healthcare provider can perform diagnostic tests such as imaging or lung function tests to determine the underlying cause of your symptoms. 5. Difficulty swallowing. Difficulty swallowing, which might seem like a minor inconvenience at first, but persistent trouble swallowing, also known as dysphagia, can actually be an early warning sign of throat or esophageal cancer. When tumors develop in the esophagus, they can obstruct the passage of food and liquids, making swallowing painful or even difficult. You might find yourself feeling like food is getting stuck in your throat or experiencing frequent choking episodes while eating. So why does this happen? As the tumor grows, it begins to narrow the esophagus, which is the tube that carries food from your mouth to your stomach. This narrowing can create a sensation of blockage, leading to discomfort and difficulty during meals. It's important to note that in many cases, by the time dysphagia appears, the cancer may have already progressed. This makes early intervention crucial for better outcomes. Research indicates that dysphagia affects about 50% of patients with esophageal cancer at the time of diagnosis, highlighting how significant this symptom can be. If you're experiencing persistent difficulty swallowing, don't brush it off as something minor. It's vital to discuss these symptoms with your healthcare provider. They can perform evaluations such as an endoscopy or imaging tests to determine the underlying cause of your dysphagia. 6. Lumps or thickened areas under the skin. Moving on to lumps or thickened areas under the skin, this symptom is often a significant red flag associated with cancers like breast cancer or lymphoma. When it comes to cancerous lumps, they tend to be firm, painless, and gradually increase in size over time. This occurs because abnormal cells begin to accumulate in a specific area, forming a tumor. These cells grow uncontrollably, often outpacing the normal cells that would typically regulate growth and repair. Understanding why lumps form can provide some clarity and help ease anxiety. Cancer cells divide in an uncontrolled manner, leading to a buildup of these rogue cells in one location. Over time, this accumulation manifests as a noticeable lump. Research indicates that early detection is crucial. For example, when breast cancer is identified in its early stages, the survival rate can reach up to 90%. Diagnosing a cancerous lump from other types of lumps can involve several steps. Healthcare providers will typically conduct a physical examination and may order imaging tests like ultrasound or mammography. In some cases, a biopsy may be necessary, where a small sample of tissue is removed from the lump and examined under a microscope. This can help determine whether the cells are benign or malignant. It's important to understand that not all lumps cause alarm. Many lumps are benign conditions like cysts or lipomas, which are non-cancerous growths that don't pose a serious threat to your health. Benign lumps are usually soft, movable, and pain-free, and they often don't grow significantly over time. In contrast, cancerous lumps tend to be firmer, less movable, and can continue to grow or change in size. They may also be associated with other symptoms like pain, changes in skin color, or unusual discharge. That said, distinguishing between the two can be tricky, which is why it's crucial to listen to your body. If you notice a lump that wasn't there before or one that keeps growing, don't hesitate to consult your healthcare provider. 7. Unusual bleeding or discharge. It's important to notice any unexpected bleeding, whether it's blood in your stool, urine, or even coughing up blood. These signs can be alarming, but they're crucial indicators that something may be wrong. For instance, blood in the stool could suggest colorectal cancer, while blood in the urine might point to bladder or kidney cancer. So, what's causing this bleeding? Typically, cancerous growths can damage the surrounding tissues, leading to ruptured blood vessels. This is why you might see blood where you wouldn't expect it. There's solid scientific backing for these observations. Studies indicate that certain cancers produce enzymes that break down nearby tissues. This process can weaken blood vessels, making them more prone to bleeding. Research shows that about 10 to 15% of people diagnosed with colorectal cancer present with rectal bleeding as their primary symptom. This means that if you notice blood in your stool, it's definitely something to discuss with your healthcare provider. When it comes to bladder cancer, blood in the urine, also known as hematuria, is often the first noticeable sign. In fact, up to 80% of patients with bladder cancer report having visible blood in their urine, making hematuria a significant red flag. Coughing up blood can also be a classic symptom of lung cancer, especially when the cancer has spread to the airways. Studies indicate that up to 25% of lung cancer patients may experience hemoptysis, highlighting its importance as an early warning sign. If you find yourself coughing up blood, it's crucial to seek medical attention promptly. 8. Changes in bowel or bladder habits. You might not think much of it, but any long-term change in your bathroom routine can signal something more serious, like colorectal or bladder cancer. Whether it's persistent constipation, diarrhea, blood in your stool, or frequent urination, these changes should raise red flags if they last for an extended period. So, what's happening behind the scenes? When cancer affects the digestive or urinary systems, it can cause inflammation or blockages in the normal pathways. For instance, a tumor in the colon can lead to obstruction, making it difficult to have regular bowel movements. Similarly, bladder cancer can cause changes in how often you feel the need to urinate or even lead to blood in your urine. The importance of early detection cannot be overstated. For cancers like colorectal cancer, if caught early, the survival rate can be as high as 90%. That's a significant number. So, if you notice any lasting changes in your bathroom habits, don't brush them off. It's crucial to discuss these changes with your healthcare provider, as they could be key indicators of underlying health issues. Your body is trying to communicate with you, so listen closely. 9. Persistent pain or discomfort. We all deal with occasional aches and pains. It's just part of life, especially as we get older. However, if you're experiencing unexplained pain that just won't go away, it could be a sign of something more serious, like bone, ovarian, or testicular cancer. When cancer begins to grow, it can press on nearby nerves, muscles, and organs, leading to localized pain that can linger. This discomfort might be easy to dismiss at first, but if it continues without a clear cause, it's essential to take notice. Research indicates that about 20 to 25% of people with cancer report experiencing pain as one of their early symptoms, and this can vary depending on the type of cancer involved. In some cases, cancer can also release chemicals that cause inflammation in the surrounding tissues, further contributing to the sensation of pain. Research has backed this up. Studies show that around 20 to 25% of individuals diagnosed with cancer report experiencing pain as an early symptom. This pain can vary widely depending on the type of cancer and its location in the body. For example, bone cancer might cause localized pain, while cancers like ovarian or testicular cancer can lead to discomfort that radiates throughout the abdomen. 10. Persistent fatigue. It can happen for a variety of reasons, especially when it's linked to cancer. When cancer takes hold in the body, it can really throw things off balance. One major reason for this fatigue is how cancer cells use energy. Unlike healthy cells, cancer cells grow and divide much faster, which means they consume more energy. This can leave your body feeling drained, even if you haven't been particularly active. Another factor is the inflammation that often comes with cancer. When the body detects cancer, it ramps up its immune response, which can lead to a state of inflammation. This inflammation can mess with how your body uses energy, contributing to that heavy, tired feeling. In cases like leukemia, the situation gets even trickier. Cancerous cells can crowd out healthy blood cells, leading to anemia. When your body doesn't have enough red blood cells to transport oxygen, it can leave you feeling weak and exhausted. And let's not forget about hormones. Cancer can affect the glands that produce hormones responsible for regulating energy levels. So, when everything's out of whack, it's no wonder you might feel persistently fatigued. If you're experiencing this kind of tiredness, it's definitely worth discussing with a healthcare provider. Your body is trying to tell you something, and getting to the bottom of it can help you feel better. 11. Unexplained weight loss. While it might sound appealing to shed a few pounds without trying, sudden and unexplained weight loss can be a serious warning sign. This symptom is particularly associated with cancers of the stomach, pancreas, and esophagus. When cancer begins to take hold, the body starts using up extra energy to combat the disease, which can lead to rapid weight loss. At a cellular level, cancerous cells grow at a much faster rate than healthy cells, consuming a significant portion of your body's energy reserves. This heightened activity can kick your metabolism into overdrive, even if you haven't made any changes to your diet or exercise routine. Research indicates that approximately 40% of individuals diagnosed with cancer experience unexplained weight loss, often making it one of the first symptoms to appear. This means if you notice those pounds dropping without any effort, it's crucial to pay attention. Your body is trying to communicate something important, and catching these early signs can be key to addressing potential health issues. So, if you find yourself losing weight unexpectedly, don't hesitate to consult a healthcare professional for further evaluation. Early intervention can make a significant difference in your health outcomes. 12. Persistent indigestion or stomach discomfort. Finally, we have persistent indigestion or stomach discomfort. While occasional heartburn or indigestion is typically harmless and often attributed to things like diet or stress, it becomes concerning when it transforms into a persistent issue. This could be an early warning sign of stomach or esophageal cancer. So what's causing this discomfort? When a tumor develops in the stomach or esophagus, it can block part of the digestive tract or change how your stomach processes food. As a result, you might experience increased acid reflux or heartburn, making eating a painful or uncomfortable experience. The presence of a tumor can also disrupt the normal muscular contractions of the digestive tract, leading to issues with food movement, further exacerbating the feeling of indigestion. Additionally, cancer can lead to inflammation in the stomach lining, which can create a sensation of fullness, bloating, or general discomfort. If you find yourself reaching for antacids week after week with little to no relief, that's a significant sign that something more serious might be at play. Your body is always communicating with you. Are you listening? These 12 early warning signs aren't just random discomforts, they could be the key to catching cancer before it's too late. Knowledge is power, and taking action at the right time can be life-saving. Don't wait until a small signal becomes a serious problem. If you or someone you love is experiencing any of these symptoms, seek medical advice and prioritize your health. Early detection isn't just about treatment, it's about giving yourself the best chance at a healthier, longer life. Thank you for watching. If you found this video valuable, don't forget to like, share, and subscribe to Healthy Care for more essential health insights. Stay informed, stay proactive, and take control of your well-being. See you in the next video.